So are we ready to start? Okay. Thank you to our members of the press. Thank you to our public who's listening in. Thank you to my colleagues, physicians who are standing here with me. Thank you to County Council, who's going to start out by making a statement.
Thank you. My name is Christian Curtis, and I am the Acting County Counsel for the County of Mendocino. I will turn this back over to Dr. Duhan in a moment. First, however, Dr. Duhan has asked me to deliver a short explanation of some of the legal aspects and authority regarding the health officer orders that went into effect last night. Dr. Duhan has recognized that the role of the local health officer and the nature of health officer orders may be unfamiliar to those outside of the healthcare industry or government. And she wants to make sure that everyone understands the legal context for what she is announcing today. Under the California Health and Safety Code, each local health officer is given the ability to craft and implement orders when needed to prevent or control the spread of communicable disease. These statutes are uniquely structured to give the health officer broad discretion to craft orders necessary for the protection of the public's health based on the specific dangers posed by each outbreak, the health officer's specialized medical knowledge and expertise, and the best available scientific information. These statutes allow for the orders to be crafted and implemented quickly in order to maximize their life-saving value in rapidly evolving emergencies. Once issued, the health officer orders are legally enforceable. State statute explicitly provides that the health officer orders may be enforced by the local sheriff or other peace officers in the county. Violation of the order may subject a person or business to criminal or civil penalties as well as other legal consequences. In particular, any business that remains open in violation of this order risks committing negligence per se and exposes itself to civil liability for all damages created by any viral transmission that occurs at their place of business. This time, I'll turn it over to Dr. Duhan.
Thank you, County Council. I'd like to thank my colleagues who are standing behind me, Dr. Chan, representing the primary care clinics in our community, Dr. Lovato, representing our first responders and EMS, and Dr. Colfax, representing our emergency physicians. And thank you to Sheriff Kendall for being in the room with us today. So I've been told that I no longer need to give you an introduction to who I am, but I will say that I'm Dr. Duhan, I'm your health officer. I've been out in front of the cameras and on the phone giving interviews and press conferences and virtual town hall meetings and sharing information with you for many weeks, as I will do until we get through this together. I have had to make difficult decisions based on facts and science, and I have explained and shared my reasoning with you. I'm here to announce the first confirmed case of COVID-19 in Mendocino County. The confirmed COVID-19 case was diagnosed in a South Coast primary care clinic. I commend the clinic for their excellent work identifying and treating this first case in Mendocino County and for protecting their staff proactively by wearing the appropriate protective equipment. We are working with the California Department of Public Health and the Federal Centers for Disease Control and Prevention. This case is still under active investigation. The details I can share with you include the person is female and under the age of 30. She had symptoms but did not need to be hospitalized and is improving. Based on the reports that we have thus far, we believe she had contact with a COVID-19 patient, but we are still investigating. She is in isolation with close active monitoring. She poses no threat to public health. This COVID-19 pandemic is a public health emergency. Based on the fact that the Bay Area and Sonoma County, right next door, are experiencing widespread community transmission of COVID-19, and with our college students coming home to Mendocino County, it is virtually certain that we are experiencing spread of COVID-19 in our community. We should be prepared to see more cases and further spread in Mendocino County in the coming weeks, as is currently happening in Sonoma County and the rest of the Bay Area. I talked with you before about the two phases in our fight against the pandemic: containment and mitigation. Until now, we have been working hard to do both at once. Given the reality of community spread, we must shift more toward mitigation. Mitigation means that more of our focus will now be on slowing the spread of the virus. This will help us maintain the capacity of our fragile healthcare system so that we can care for those who do develop COVID-19 disease. This is why yesterday I issued a health officer order to shelter in place. Sheltering in place is a powerful way to increase social distancing, the most effective tool to slow the spread of COVID-19. We have received troubling reports that some businesses are ignoring the shelter-in-place order. The health officer order is a legal document which will be enforced. As an example, I have ordered the closure of a business that knowingly continued to operate in a manner that created a risk to the public's health: the Breakers Hotel and View Restaurant in Walala. Social distancing can work. We've seen it work in the most hard-hit countries, but to work, it will require all of us to sacrifice. This is going to be hard, and it will hit some of us harder than others. But it is what we have to do to protect our healthcare workers, to protect our first responders, and to protect the people we count on to take care of our children, our elders, our families, and our communities. We are all in this together. So now I would like to take a single question from each of the press who is present in the room, and I'm going to be relying on Ashley. So you can ask your question of Ashley. She'll direct it. And also, Ashley, before we begin, I would like Dr. Mark Lovato to step up and speak to you to represent our first responders in EMS.
Hello. I've been part of the EMS system here since I started working here in 1981. I'm a full-time ER doc, but involved in the EMS systems. And we want you to know that the EMS providers are there ready to help you. One of the things that's been clear, though, is that we want to limit the worried well from calling 911. Call your physician. If you have a strong concern or you're feeling very well, access 911 as you normally would. We're coming in the state. In the state, we currently have a tremendous issue of a lack of PPE, personal protective equipment for our first providers. So we're trying to allow our providers to come assess people, but only have one provider actually get dressed in full precaution. So our dispatch will often ask our patients if they're able to come to the door. One provider will, some of the initial first responders might ask them questions at a safe distance to get the assessment going. And if they're still stable, they'll wait for the transporting provider to come. And that will only usually be one provider who will be dressed and protected in order to preserve PPE and in order to not expose an unnecessary amount of our responders. We're also mitigating and changing our provider treatment guidelines to provide safety for the healthcare workers, but without sacrificing the safety of our patients. What we need to know is that our pre-hospital care people have been very busy even without COVID-19. We've been running lots of calls. We know that there's an ambulance problem in terms of depth of coverage. So we want people to access 911 carefully, but if they're concerned, we're ready to respond.
I did also want to mention that the order of the health officer for sheltering in place is available online, and it was modeled after the Bay Area shelter in place orders, which were presented in unity by all of the health officers of the 6 big counties of the Bay Area. It was modeled after those orders, so you can find it online. It does have some rural, what I call rural nuances. I'd also like to say that, you know, I'm going to have to be leaving promptly after we have one question from each of the journalists, but I imagine that Dr. Colfax and Dr. Loato and Dr. Chan would be available to answer questions from the press if you would like to speak to emergency physician, director of EMS, or one of our primary care doctors. But after the one question each from the journalists, I will be stepping back out into our Emergency Operations Center. One question that I just want to answer right up front regarding what sheltering in place means. We want people to stay in their place of residence. You might be staying with a family member in their home, or you might be staying with somebody that you are very close to, like family. Stay there is what we're asking you to do. We want you to stay in the place where you are residing and only to leave for what we are calling essential activities and essential business. Those are those activities that are required, like getting food, medicine, medical care. And the essential businesses, as you can read in the order, are limited. And I would encourage you all to go online, but they are limited to those businesses which we deem are essential for the basic functioning of life. So, Ashley?
I'm wondering if there's been any more thought about the businesses that are essential to non-human life, like humane societies, animal rescue, or businesses that have animals for recreational purposes that are not agriculture or pets, like part of the house.
So we are,
I'm going to repeat the question.
Oh, I'm sorry.
So the question was about, has there been any thought given to businesses that have to do with non-human life, such as animals, animal care, etc.?
So we would ask that businesses maintain their minimum operations. So I would assume that those businesses would operate in such a way that they can keep the animals there alive and stable and well, but in as much as they may involve other people coming in to that business, we want that to be limited as much as possible.
That includes humane society and animal control.
So they're going to have to keep it, does that include humane society and animal control? We want the minimum operation necessary to keep those animals safe. Okay.
Unfortunately, for some people, the communication or the information is based on rumors.
Yeah.
So there's a lot of confusion between the order of shelter in place and quarantine. Can you explain again what's the difference between
Yeah.
them? Because some people think that we are in quarantine,
Yeah.
not in shelter.
Would you like your question translated into Spanish?
Yeah, maybe later.
Not, you have one question, so we can do it now.
I'll
Sure.
repeat the question first.
In English.
So the question was on, there has been a lot of misinformation going around, rumors, and there's been some confusion about the terms self-isolation and quarantine. Can you please explain?
Can I ask the question in Spanish? Hay mucha información falsa y hay mucha confusión acerca de entre la orden de estar resguardado en casa y cuarentena. ¿Cuál es la diferencia y en qué situación estamos ahorita en el condado de Mendocino?
Would like to answer first, and then I translate it?
Yes. So, quarantine is for somebody who has been exposed to the disease, but they do not have symptoms. So to give you an example, we knew the people coming back on cruise ships, there were certain cruise ships where they had outbreaks of the disease. When these people come back, and it's the public health department is informed of their return, the public health department contacts them and says, you must quarantine in your home for 14 days since you were exposed. They are not sick. So quarantine is for somebody who's been exposed but not sick. Shelter in place is for all of us. I've been sheltering in place. I'm only coming here to do my essential work, and then when I go home, it's just to sleep. So we do, shelter in place is what all of us are doing, not those people who've been exposed to the disease who would be quarantined. We may have people quarantined in our home. That's a complicated question. Right now, we don't have anybody in our county quarantined in the general population.
Ok, la diferencia entre tener a alguien bajo cuarentena es básicamente aquella persona que ha sido expuesta a la enfermedad o al virus. Y para la persona que tiene que quedarse en casa, es la persona que está sana, que no ha sido expuesta y tiene que quedarse en casa para evitar que esta persona pueda adquirir el virus en el futuro de otra que ha sido expuesta al virus. ¿Responde su pregunta ello?
Sí. ¿Y cuál es el estado ahorita? ¿Estamos en cuarentena o en shelter in place? Nada más para que quede claro para la gente.
Ok, actualmente estamos bajo la shelter in place, que es quedarse en casa. Esa es la orden que se ha dado para todos los habitantes del condado de Mendocino. Okay.
And not only those residents of Mendocino, but those residents of the entire Bay Area, Sonoma County, in fact, our state. So all of the people are sheltering in place. I had a question that I'd like to respond to. Is it okay for us to walk outside? Yes, it's okay to walk outside. If you have a child, you can walk outside with your child so that they're safe. But we want people, when they're walking outside for exercise, for the essential activity of exercise, to stay 6 feet away from other people. The purpose is we do not want to give a way for this virus to spread through our community. That's why we're social distancing. That's what sheltering in place is for.
Right now, we're doing the universal shelter in place except for essential tasks. I'm wondering if there's any kind of escalation, any state of escalation beyond that, and at what point you would consider doing that.
The question was, right now we're sheltering in place, and the question was considering if there was an escalation point, at which point we would consider doing anything beyond sheltering in place.
Thank you for that question. We are doing this because we want to see an effective response to the spread of this disease. We all, when we look in the news, can see what's happening in Santa Clara County, in San Mateo County, in the Bay Area, in fact, in Sonoma. So we will know that we're being effective when we do not see this disease spread through our county. If it is not effective, if we start seeing spread of this disease continuing to escalate in the Bay Area and to escalate in our county, then I do expect that from the federal government level to the state level to our regional level, we will be asked to have even more restrictive rules and orders in place, which would require us to not have, for example, essential businesses be as expansive as they are on our list. And this is a reality that is very hard for all of us to absorb. And I would ask you to look at what's been done in those countries, that were actually able to contain or mitigate COVID-19. You know, look at China, look at South Korea, look at what they did. And then you might compare that to other countries where they didn't do these things early enough.
You gave a brief summary about allowing some
Yeah.
essential businesses, gardening, it's about that time, soil, things like
Yeah.
that. And that seems to be an essential thing, but could you elaborate more? There's a lot of people that have already been affected by the wildfires and
Yeah.
they're feeling that pressure.
Yeah. So
Could you elaborate more on, this is the question, could you elaborate more on essential business regarding agriculture?
Yes. I'm just going to look for the actual line. Oh, it would take me a moment to find it. You know, I do encourage you all to read the document, which is available online, but we do essential business includes ranching, farming, anything involving agriculture, or agricultural activities. We didn't limit those agricultural activities to business activities. In other words, we realize that there are people who have personal farms, there are people who farm for their own family, and we are asking that when those essential businesses that supply resources for farming sell those items, they do so in a way that doesn't cause there to be interaction with individuals in close contact. So again, it's all about social distancing. So we're asking businesses to develop ways that they can have curbside drop-off, so that you're not going into the store and shopping and touching items, so that you might be able to order ahead and have those items ready to pick up at the curb. So it's going to take us all being very careful about thinking about when we purchase something from an essential business that we're still practicing social distancing in that process.
The question was, how are we following up with the contacts of the first case, and how will testing operations continue from this point?
So let me clarify what I said about quarantine. We do have 5 people that are in quarantine that we're actively monitoring in our county. These are people that are return travelers to our county, and what I meant to say is none of those people are quarantining with the general population. So for those people that are sheltering in place, which is all of us, the 5 people we're monitoring that are in quarantine are either alone or with their family unit. So I don't have any mixing of quarantine people with a general household that's not in quarantine. So we have some people that we're actively monitoring in quarantine, which are to themselves, and then we have the rest of us who are all sheltering in place, just to clarify that. About the case, there's standard practices of epidemiology and public health. Whenever we have any communicable diseases, what we do is we do contact tracing. So we look at who the person might have contacted, and then we reach out to those individuals. So we just learned about this case last night, and we're in the process of doing that work of identifying the individuals that were in contact with this person. It's a lot of work, and we are doing that work. So it began today. Yes. Will testing be a piece of that? Yes. That is part of the way that we do contact tracing, is that if we have a case, if somebody in contact develops symptoms. So there's nobody that we are aware of who had contact with this individual that has symptoms. So if they have contact but they don't get sick, then they are not tested. But they are told to quarantine. So we're in that process. We are quarantining people that have come into contact with this individual, but none of them are sick. So none of them have been tested. If one were to become sick, they would be tested. So I just want to be sure that I answer that any known contacts of this individual are quarantined. Okay? So that's going to be it for me, but I welcome my colleagues. If you have any questions for Dr. Colfax, Dr. Lovato, Dr. Chan, if you want to address them, I welcome you, and I appreciate your time coming here. I do know that Dr. Colfax and Dr. Lovato, and maybe Dr. Trotter, you can talk about it, are having a radio show to share information. But I am going to leave. Thank you very much. Okay. Okay.
Can you go into some more detail about how
questions will be taken after the press conference ends. You can approach them separately.
Oh, good.
Thank you.